Did you know that US lawmakers just voted to make it illegal to share the Palestinian death toll in Gaza? And this comes as recent data suggests that the number of deaths is actually much, much higher than being reported. The Lancet, one of the world's most prestigious medical journals, just recently published a report estimating that the death toll on the conservative end could exceed 186,000 people, with the real tragedy unfolding in the hundreds and thousands of people that will die indirectly as a result of all the devastation. As of July 3rd, the Gaza Health Ministry has reported approximately 38,000 deaths, including more than 15,000 children. But these numbers have remained stagnant over the past several months, despite the ongoing violence that we continue to see every single day. And this is because obtaining continuous and accurate death toll figures has become almost impossible after the near total destruction of the whole health information system, leading to significant underreporting of these deaths. The Lancet report highlights that conflicts result in indirect deaths and long-term implications beyond just the direct killings that we are seeing from bombings and shootings. What they did was use data extrapolated from previous conflicts and found that indirect deaths have ranged from 3 to 15 times of direct deaths. And in the Lancet report, they used the conservative estimate of 4 indirect deaths per direct death, arriving to 186,000 deaths, or 8% of Gaza's population. But this number could potentially be up to 600,000 deaths, or nearly 25% of the population. And this is assuming that there is a ceasefire today. If not, this number is predicted to only rise exponentially. So essentially, even if there was a ceasefire today, indirect deaths from things like famine, dehydration, disease, and the collapse of healthcare services are inevitable consequences. And if you still doubt these numbers, take a look at these UN reports. An estimated 1.1 million people are facing catastrophic levels of food insecurity due to the purposeful blockade of food and the destruction of livestock and agriculture. That's nearly half the population on the brink of forced starvation. And recall that half of Gaza's population is made up of children. So children are essentially being starved to death purposely. Second, the lack of clean water is beyond devastating. Water is now even a source of danger because 90 to 95% of all water has been found to be contaminated and unfit for consumption, causing not only widespread dehydration, but deadly outbreaks of diarrhea, cholera, hepatitis A, and severe skin infections. And on top of all of this, Gaza's healthcare system has been systematically and deliberately targeted, with nearly all hospitals bombed or attacked, while medical supplies are being prevented from entering. This has left countless people without essential medical treatments for things like cancer, diabetes, cardiovascular disease, and all sorts of common diseases. So patients, for example, with cancer who could have been saved will die due to lack of cancer treatments. Patients with diabetes no longer have access to their medications or dialysis, and the list continues to go on. This crisis is also especially dire for pregnant women, children, and newborns, with over 50,000 babies born amidst these dire circumstances, and their mothers lacking clean water and adequate nutrition, leading to high levels of maternal and infant mortality rates. This is not just a humanitarian crisis, it is a systematic extermination of an entire people, and the world must recognize the enormity of this catastrophe. Every single human life matters. Palestinians are not just numbers, because behind these figures are real people just like you and I, mothers, fathers, sons, daughters, families torn apart. We cannot hide this reality, and it is absolutely disgusting that US lawmakers refuse to acknowledge Palestinians both in life and death. We have to do whatever we can to stop this. We must continue to boycott, divest, and sanction Israel, every single one of us, and history will judge who stood against this genocide and who supported it. And it's up to you to decide where you stand.